What is Coumadin, and why do I have to take it? Right now, you're probably asking yourself these questions. That's okay, because you'll find the answers to these and other questions in this video. Coumadin is a medicine that increases the time it takes for your blood to form clots. Normally, your blood forms clots to keep you from seriously bleeding when you cut or injure yourself. However, you have a medical condition that may cause your blood to form clots that your body doesn't need, and these clots may cause serious medical problems. One place clots may form is in the heart. Some patients have artificial heart valves, which are needed to direct the blood flow correctly. Clots may form on or around these artificial valves. Another condition patients may have is a heart that does not beat correctly. This irregular heartbeat, known as atrial fibrillation, may cause clots to form in the heart. These clots can get bigger and may break loose. If they break loose, they can move to other parts of the body and cause problems. Another place clots can form is in the leg. A clot in the leg can get larger or move to another part of the body, like a lung, and cause even more damage. When clots move to organs like your liver or kidneys, the organs may get damaged and not work right. When they move to the blood vessels around your heart, you can have a heart attack. And when clots move to your brain, this is called a stroke.
Once you have a stroke, you live in fear of another one. I don't think you ever get over the fear that it might happen again. And it comes on so sudden, there's no warning. And it was after the stroke that he put me on the Coumadin. Well, I'm glad I'm on it. I'm glad somebody invented it, decided it was good for us stroke patients.
Obviously, every situation and every patient is different. Some of the conditions we just talked about may cause a stroke if not treated. Your doctor wants you to take Coumadin because it will help reduce the body's ability to form clots that your body does not need. Coumadin has helped many people, but like all medicines, it may be harmful if not used right.
I did forget one time, and I was a little scared because I thought something terrible might happen to me. But it's a very simple matter of calling your doctor, just checking to see when you should take your next dose of Coumadin, and that's all there was to it.
So it's important that you listen to your doctor, nurse, or pharmacist, also called your healthcare provider. Follow their directions. As a Coumadin patient, you will have regular blood tests. This test is called a prothrombin time, or ProTime for short.
At first, getting ProTime tests was kind of a nuisance. You have to go down once a month and have your blood checked for clotting and so forth. But now it's no problem at all.
I really don't mind going at all. I'm kind of grateful there's someplace I can go, when I think of the alternatives.
ProTimes are very important. They help your healthcare provider see how fast your blood is clotting. ProTimes also suggest if your dosage of Coumadin should be changed. Your ProTime may also be called your International Normalized Ratio, or INR for short. Another important thing you should know about Coumadin is that it may cause bleeding. Remember, we said earlier that Coumadin increases the time it takes for your blood to form clots. That's how Coumadin helps decrease the possibilities of medical problems like stroke. But because Coumadin lessens your blood's ability to form clots, you may bleed more when you cut or injure yourself. So it's important to take your Coumadin as instructed.
I've been told that if I cut myself shaving, and so I use an electric razor, or have any kind of a cut and bleed, make sure I get attention right away or even call the doctor, because I might continually bleed. I haven't had that problem.
And they tell you to watch out for certain things, excessive bleeding when you brush your teeth, when you go to the bathroom, you have to watch and see if there's any blood or anything like that.
If you notice unusual bruising, or if you have nosebleeds or other bleeding that does not stop, call your healthcare provider right away. Also call your healthcare provider if you have more bleeding than usual when you brush your teeth, or when you get your menstrual period, or if you have dark brown urine or red or black in your stools. These things may mean that your dosage of Coumadin may need to be changed. That's why it's important to look for signs of bleeding and stay in touch with your healthcare provider. Try to take your Coumadin at the same time every day. Before taking your Coumadin, make sure that it's the correct dosage. Check the number on your tablet and make sure the tablet has the word Coumadin printed on it.
So I normally, when I get up in the morning, the first thing I do is I go in and take all my medications.
It's like getting up, putting your shoes and socks on in the morning, you know.
Remember to tell anyone giving you medical or dental care that you take Coumadin. You may also want to consider wearing a medical alert bracelet or carrying a Coumadin patient identification card. Your healthcare provider can help you get either of those. Since your dosage of Coumadin may change from time to time, make sure you take the right dose on the right day. To help you keep track of your dosage and your pro-time tests, you may want to use a dosage calendar. Your healthcare provider can help you get one.
I've taken 4 milligrams, 5 milligrams on alternate days. So I kept my little book. And every day I write it down in the book, which is, you know, keeps track.
As a Coumadin patient, it's important that you keep your lifestyle and activities consistent. If you want to try a new activity or sport, tell your healthcare provider. Your healthcare provider may want you to avoid any activity or sport that may make you have a serious fall or other injury. It's also important to keep your diet consistent because some of the foods you eat may affect how Coumadin works. If you plan to make major changes in your diet, or if you'd like more information about diet and Coumadin, ask your healthcare provider.
And I have to watch the vegetables because the vegetables affect me more than anything else, especially the K vitamin vegetables. So in general, you get used to it. And I have a good cook, so it works out all right.
It doesn't seem to be any problem living with a person taking Coumadin, except just to make sure they're not taking too many vegetables or different types of food that has too much vitamin K in it.
These are important things you should do as a Coumadin patient. However, there are also some things you should not do while taking Coumadin. Do not take any other medicines, prescription or non-prescription, before asking your healthcare provider. Do not take Coumadin if you're pregnant or may become pregnant. Do not take an extra pill to catch up. If you forget to take your Coumadin pill, tell your healthcare provider. Avoid use of alcohol. By being a well-informed Coumadin patient, you will be a more active partner in your health care. If you'd like to know more about Coumadin therapy, ask your healthcare provider. Take your Coumadin exactly as instructed. Stick to your pro-time test schedule. Look for signs of bleeding and call your healthcare provider if you have any questions, problems, lifestyle changes, or symptoms possibly related to the use of Coumadin, such as a serious fall or head injury, fever or sickness that gets worse, vomiting, coughing, or throwing up blood, diarrhea, infection, pain or swelling, dizziness, trouble breathing, chest pain, or if you feel weak or more tired than usual.
If I were talking to someone just starting on Coumadin, I think the first thing I would say was just to relax. It isn't a stressful situation unless you make it stressful. Just relax, do what your doctor tells you to, take your Coumadin at the same time every day, and enjoy your life.
And I'm grateful that they have it, period.
I can thank God that there is something out there that could help me, you know. And when I think of the alternatives, you know, it's great